Why is the nasal dorsum challenging in revision rhinoplasty? Imagine trying to fix a delicate sculpture that has already been shaped once before. The nasal dorsum, or the bridge of the nose, is a complex area that presents many challenges when surgeons need to revise a previous rhinoplasty. This part of the nose is made up of both bone and cartilage, which work together to give the nose its shape and support. When a primary rhinoplasty is performed, the surgeon often alters these structures to improve appearance or function. But in revision cases, the anatomy has often been changed or damaged, making further adjustments tricky. One of the main reasons it is so challenging is because of structural instability. After the first surgery, the bone and cartilage may become weakened or distorted. Scar tissue forms as part of the healing process, and this tissue can make it difficult for the surgeon to work precisely. Scar tissue can obscure normal anatomy, making it hard to see where to reshape or remove tissue without causing further problems. This instability can lead to irregularities or asymmetry if not handled carefully. Another issue is irregularities and deformities that often develop after the initial surgery. These might include bony or cartilaginous bumps called dorsal spurs, depressions, or uneven contours. Correcting these imperfections requires meticulous removal or reshaping, but doing so without compromising the nose's support is a delicate balancing act. Over-resection can lead to problems like saddle nose deformity, where the bridge collapses, or inverted V deformity, which affects the nasal profile. The skin covering the nose also plays a role. After previous surgeries, the skin may become thinner or less elastic, reducing the surgeon's ability to hide irregularities. Achieving a smooth, natural look becomes more difficult when the tissue envelope is compromised. This limited tissue elasticity often means that even small imperfections are more visible. Functionality adds another layer of complexity. The nasal dorsum is not just about looks, it also helps with breathing by supporting the internal nasal airway. During revision surgery, surgeons must preserve or restore this function while correcting external deformities. This dual focus makes planning and execution more complicated because they need to avoid narrowing the airway or damaging internal structures. Risks are higher because of the proximity to critical areas like the nasal septum and the skull base. Aggressive work on the nasal bones or cartilage can sometimes lead to complications such as septal perforation or, in rare cases, injury to the skull base. Surgeons must carefully weigh the benefits of correction against these potential dangers, especially since previous surgeries may have altered normal anatomy. Technical complexity is another factor. Every revision rhinoplasty is unique, requiring a customized approach based on the current state of the nasal structures. Surgeons decide whether to use grafts, such as cartilage from the septum, ear, or rib to rebuild support. Sometimes less invasive techniques are suitable for minor irregularities, but often more advanced methods are needed. This demands a high level of surgical skill and experience. Finally, patient expectations can make revision rhinoplasty even more demanding. Many patients are dissatisfied with their previous results and hope for dramatic improvements. Achieving these goals without creating new problems requires precise technique, thorough planning, and sometimes innovative solutions. In summary, the nasal dorsum is challenging in revision rhinoplasty because prior surgeries often weaken or distort its structures. Scar tissue complicates dissection, and the surgeon must carefully balance aesthetic improvements with preserving nasal function. These factors highlight the importance of specialized surgical expertise, individualized treatment plans, and careful risk management to achieve the best possible outcome. Always consult a qualified facial plastic surgeon to discuss your specific needs and options.